We're back with Heather, and she's going to help give you some information during the holidays, what you can do if you're traveling, take care of your teeth. If you have an older family member that has loose denture, a lot of people want to know what to do if they lose a denture. Dr. Brown's going to talk about what happens if you have a toothache and you're on an airport or a foreign city.
Hi, Dr. Rich. My name's Steve. I have a question. I'm going to be traveling over the holidays to visit friends and family, and I'll be out of town. What do I do in the event of a dental emergency when I'm traveling like that?
So, Dr. Brown, someone's on a plane, they get off the plane, they have a toothache. What do? They're in LA, they're in Denver, they're in Miami. What do you think they can do to get a dentist to treat their problem?
Well, most dental societies are listed in the phone book, also on the internet, and they have a listing of dentists who will see emergency patients. Many hospitals have dentists on staff, and they also have people that are on call. There are dental schools in a lot of the major cities, Temple being one of them in Philadelphia. You could call the dental school and they have emergency services available as well. If you're only going to be in an area for an hour or two, you could go to the local CVS or Walgreens pharmacy, and they do have things that you can put in teeth that will take care of the pain. But you're always better off to try to get a professional to take a look and help you.
Hi, Dr. Rich. Just recently, as I've been brushing my teeth, and sometimes even when I floss, I've been noticing my gum has been bleeding. Is that normal, or is that something I should be concerned about?
Well, generally, a patient that has bleeding gums is usually an indicator of some sort of periodontal infection. It's never normal to have bleeding gums. That's what we always tell our patients. So usually we have to evaluate them. We always do a thorough periodontal screening exam, which is actually the measuring of the pocket depth around the tooth. That's done at every visit.
If we have an instrument that has little marks on it and they measure millimeters, and we want to make sure we're in what would be considered the normal depth of a pocket around the tooth. It's normal to have a pocket around the tooth. That's how a tooth is supported, but when the pocket around the tooth is deeper, there could be swelling or loss of bone, or what we say professionally, a loss of attachment, and then we start to see the results of infection, which is bleeding or swelling gums. Usually, if it's not a severe condition, a couple of visits, we can solve the problem.
Hi, I have a question. How important is flossing? Is it okay if I skip it?
What do you tell a patient in our office when, they're traveling and they say, look, I don't floss? What do patients say?
I try to tell patients, to try to do your best. I know it's, the holidays, but we really do recommend flossing at least once a day, especially at night before you go to bed, because you never want to go to sleep with anything laying in between the teeth, because that's where most gum problems start, is in between the teeth. So we really do stress daily flossing, and at least if they're brushing, try at least twice a day. And
one of the things I tell patients, you'll be at your Christmas dinner or holiday dinner, and you notice things get caught between your teeth. And in restaurants they have toothpicks and things like that. Actually, you're not supposed to have those spaces. You really need to talk to your dentist about it, or find out why I'm need to use a toothpick after every meal. We'll be right back.